Hello, good afternoon. Today I am going to explain how we are doing IUI in our center. So first of all, I want to tell which equipments are needed. First, centrifugal machine, test tube warmer, or if some people have incubator, it's also okay. We are using test tube warmer in our center. So this is IVF grade conical tube, 15 ml. Ipendrop 20 microliter micropet. This is permanent marker for labeling. 15 ml test tube. And Vitromade tip or Gilson tip also okay. And this is laminar airflow. So we are doing all procedure under laminar airflow. We are using FertiPro density gradient media, and this is easy wash, FertiPro easy wash media. So first of all, I am bringing container. So IUI is coming under PCPNDT Act and ART law. So any procedure which is coming other than vaginal internal intercourse, that is coming under ART law. So for IUI we have to fill the consent form first. So PCPNDT Act sonography form also we have to fill. After this filling form and bill, we are going to proceed for IUI procedure. So first we label patient name on the test tube. So we have to label patient name on test tube because sometimes mixing is also happen. So we have to follow the proper labeling. There is no mistake of mixing and all. So Dinesh Gunjkar DG. One another tube we are also taking. This is sperm wash. We want some sperm wash after procedure. So we need this also. Lower density gradient. This is lower density gradient. So we should not take bubble. So this we are putting in warmer for at least half an hour. Then take 4 ml. 4 ml sperm wash media. This also we are putting it test tube worm. Another test tube. This we have to put for last procedure. Swim up. And wait for half an hour. When temperature is going to maintain 37 degree, up to that time we have to do semen analysis for this patient. So I am going to do semen analysis first. Mix sample thoroughly. Take 10 microliter sample. You can see how initial sample. After 30 minutes our temperature, after 30 minutes our temperature is 37 degrees Celsius. So now we are loading sample. Balance tube also required. This is our sample tube and this is balance tube. So now we are going to run this sample for 15 minutes at 1500 rpm. Now we are going to run this sample for 15 minutes at 1500 rpm. Centrifugation is finished now, so we are removing sample. Firstly, we are going to remove supernatant. Remove supernatant without making bubbles and disturbing pellet. Take sperm wash. And mix pellet in sperm wash without making air bubbles. Again we have to centrifuge for 5 minutes at 1500 rpm. Okay. We are centrifuging this sample for 5 minutes at 1500 rpm. Now finish. The centrifugation is finished. So we are removing supernatant. Okay. Remove supernatant without disturbing pellet. Don't make air bubble. We are adding 0.4 ml media. And mix it. Sample is ready for IUI. Now we can see how much good sample is.
Lab is very important. So in each and every case of infertility like IUI and IVF, we strictly follow the protocols which affect on our success rate. So the sterility is the main purpose. So we never used cosmetics, the things that are produced from any chemicals that harm to the embryo, sperm and oocyte. So today we are discussing about IUI. So we are going forward. We are using sterile materials or trolley. What you want in IUI? First of all, cuscos, then standby valsellum, sponge holder for painting and draping, simple cotton. So we in our routine OT we used betadine for sterilization and cleaning purpose. In IUI and in IVF, both things. Especially in IVF centers, we are using normal saline. So what is the difference between IUI in normal labs and normal gynecology setup and IVF setup? This is the only difference. The total sterility maintained in IVF lab, it's very good and output for same. So always try to make discipline and good schedule in IVF lab. And in small setups like gynac setup, there is very important to make sterile environment for at least IUI if you are doing IUI in small setup. So we are doing this IUI, USG guided IUI. So it is not mandatory always to do a USG guided IUI, but we have facility and we are charging for same. So we are doing each and every step by protocol, which is mentioned in book and we developed with our experience. So transabdominally we'll guide for same, we'll guide and we'll pass catheter and inject semen. So we already seen how the semen is prepared, double density gradient. So this is the uterus, it's endometrium, and our cuscos forceps is here only. Okay, so we are doing IUI with the USG guided IUI. So this is same steps we are following in frozen embryo transfer in IVF also same. So if somehow this patient goes for IVF, this is also a mock trial for that patient. So the steps will not change. So the approx and daily the cervical length is about 3.5 centimeter. So we are setting our catheter at 3.5 centimeter in order to do not disturb endometrium. So what includes in it is same that of a IVF catheter. The difference in just in caliper. So when injecting syringe, injecting and guiding catheter only. Okay. So you can easily see the catheter is here only. We are just cross internal os and we are just entering the endometrium. Okay, uterine cavity. You can see easily. See. Okay. Moment. Just aspirate the sample that we have already prepared. Do not include bubbles within. So aspirate in such a way that there should be no bubbles. Okay. The catheter is nicely passing through endometrium. Just below the this is a catheter only. That ecogenic focus is catheter only. We are injected. Because of over distended bladder, the visuality is a little bit less, but we are in good planar endometrial cavity. Okay. So these are the only things that you are followed in. What things you are advising the patient next to this? So we are giving progesterone support, luteal supports for this patient, and we advise this couple to make your natural contact also, so sexual intercourse, but after 24 hours, because at least 24-48 hours required for the sperm maturity. So thank you.